Hi, my name is Eri Millrod. I am faculty at Rider University. I teach dance move therapy in the master's program in clinical mental health counseling. Today I'll be speaking about compassion fatigue and self-compassion during challenging times. I'll bring in the perspective of dance move therapy to use the body and the mind to address compassion fatigue if you should be feeling burnt out, overwhelmed, and fatigued from all that we've been going through. So dance move therapy uses the body in dance and movement to address an individual's emotional, social, cognitive, and physical wellness. We use the healing factors of dance intentionally, such as the organizing effects of rhythmic movement, the expressive possibilities of dance and movement, the deep connections that happen on the nonverbal level through nonverbal communication, and the creative process that uncovers pre-verbal and unconscious material. The foundational premise of dance movement therapy is that the body and the mind are one. So when I talk you through an exercise towards the end, how to use dance movement therapy technique or approaches to address compassion fatigue, the body, the mind, and the spirit will be addressed. So now I would like to share with you my PowerPoint slides. So, compassion fatigue and self-compassion during challenging times. So, compassion fatigue is a combination of burnout and secondary traumatic stress. It's when helping others compromises our own well-being. It is a condition characterized by emotional and physical exhaustion, leading to a diminished ability to empathize or feel compassion for others. It's often described as the negative cost of caring. So if caring is the risk factor, you can imagine that it puts a lot of people in different professions at risk. Teachers for sure, counselors, therapists, and parents who show consistent care to others. So a little bit about burnout. So burnout is the physical, emotional, and mental exhaustion due to depletion of one's ability to cope with everyday environment. Secondary traumatic stress is when exposure to extreme events experienced by somebody else causes overwhelm within us. So it could be an actual or threat of death, serious injury, or threat to the physical and emotional integrity of oneself or others. So how do you know when you're suffering from compassion fatigue? So compassion fatigue can manifest in multiple levels: cognitive, emotional, behavioral, spiritual, and somatic. So it can show up in many ways. So on a cognitive level, you might notice that you have poor concentration. You might be feeling apathetic, disoriented. You might find yourself minimizing things or being preoccupied with trauma. On the emotional level, you might be feeling depressed, sad, anxious, guilty, angry, numb, fearful, helpless. And in general, you might notice that your affect is blunted or increased. On the behavioral level, you might be noticing lower frustration tolerance, irritable, being withdrawn, being moody, having poor sleep, nightmares, noticing changes in your appetite. You might also feel dread about working with certain types of people, having difficulty functioning outside of work or professional capacities. And some people might even turn to ineffective or self-destructive, self-soothing behaviors such as drugs or excessive use of alcohol. On the spiritual level, one might start questioning life's meaning, experience a loss of purpose, loss of faith, loss of hope. It might even begin to question religious beliefs. On the somatic level, there's an increased negative arousal, so sweating, rapid heartbeat, breathing difficulties, aches and pains, dizziness, impaired immune system, headaches, difficulty falling asleep, and staying asleep. So if compassion fatigue affects us on all these levels, how do we combat compassion fatigue? So there is this counterforce to compassion fatigue, which is compassion satisfaction. So compassion satisfaction has been found to be a protective mechanism against compassion fatigue. Compassion satisfaction are the positive feelings, a sense of fulfillment, satisfaction, pleasure, purpose, and gratification that come from giving compassionate care to others and alleviating suffering in others. So it helps tip the scale towards compassion fatigue and away from compassion fatigue. So to tip the scale towards compassion satisfaction, one has to exercise self-compassion. So if compassion is being with others in their suffering, self-compassion is about being open to one's own suffering. It requires being mindfully aware of your emotions, of how you're doing inside you. You have to be willing to look at your own suffering, not avoiding it. And it's about healing oneself with kindness. So to exercise self-compassion and self-care, here's some things that we can do. So the art of possible. So to exercise self-compassion, we acknowledge that we are doing what is possible to do our best with the available resources. We may not have time to go do a 30-minute exercise, but perhaps we can sit mindfully for 5 minutes. Resiliency. So trust in your resiliency. Trust that inside you there are inner resources and self-compassion to help you heal and grow. Exercise responsible selfishness. So people who are caring often have a difficult time focusing on themselves, feeling like they're being selfish. But there's an ethical imperative to take care of oneself, because if you're not taking care of yourself, you can't take care of students, you can't take care of children, you can't take care of others. You also want to exercise empathic boundaries. So balance between being over-involved and being emotionally detached. You want to be involved, but also maintain some sense of separation so you're not enmeshed. You also want to engage in reflection and inner awareness. So attend to your own emotional needs, your inner self. Exercise self-acceptance without judgment, being open-minded, being patient with yourself. Accept yourself as you are. The idea is that you are good enough. And letting go of self-blame, judgment, and guilt. And this idea of this post-traumatic growth. Know that through difficult times, by assigning meaning to the distressful events, we can still grow. So self-compassion and self-care is a holistic approach. We have to engage our mind, our body, and our spirit. So let's take a moment to exercise some of this, what we've talked about, what it looks like and what it feels like. So take a moment to just sit down or to stand, whatever feels right for you. If you're sitting, make sure you're sitting with your seat well supported by a chair underneath you or the floor beneath you. Notice the point of contact of your sit bones, your ischium, and notice that your spine is nice and long and balanced between the pelvis, and that your head is resting nicely on top, poised, gently just balanced at the very top. And if you feel comfortable, you can close your eyes, or you can soften your gaze, focus on something on the floor, but focus inwards onto yourself. And just take nice deep breaths in through the nose, and exhale slowly through the mouth. Breathing in 4 counts in through the nose, and exhaling 6 counts out through the mouth. In, 2, 3, 4. Exhale, 6, 5, 4, 3, 2, 1. And just continue to breathe fully and deeply, naturally, without forcing anything. Just noticing your breath. Letting go of distractions, emptying your mind, letting go of judgments, just being present with your breath, just noticing the rhythm of your breathing in and breathing out. Notice how your chest and your abdomen rise and fall as you breathe in and you breathe out. And you might even notice the regular, steady rhythm of your heart. Just breathing and being present with yourself. Breathing in through the nose and exhaling through the mouth. And start noticing how your breathing affects your whole body. How do your muscles respond to your breathing? How do your muscles at the top of your head, sides of your head, the back of your head, and the muscles on your face, how do they respond as you breathe? Just notice. And notice how the muscles around your neck is affected as you breathe in and out. The muscles around your shoulders. And the muscles in both your arms. How do the muscles in your arms respond to your breathing? Do you notice anything? There's no judgment, it's just about noticing. Just noticing the muscles of your entire arm, from the shoulders all the way down through your elbows, your forearms, your wrists, your hands, all the way to your fingertips. And how do the muscles on your chest feel as you breathe in and out? The muscles of your abdomen, the pelvis, and how are your muscles in your back, your upper back, mid back, lower back, all the way down to your tailbone. Just noticing the muscles responding to your breathing. And now notice the muscles around your pelvis, your hips. How do your buttocks feel? Your gluteus maximus. The muscles around your thighs. Your hamstrings. The knees. The lower legs. All the way down into the ankles. Your feet, the tops of your feet, the bottoms of your feet, the arches of your feet. And how do the muscles in the toes respond to your breathing? Just noticing. Allowing the breath to affect all those muscles in your body, from head to toe, moving freely through your body as you breathe in new oxygen, new air. And exhaling, tension, letting go, whatever you don't need, just noticing. Being present with yourself, your body, breathing. And scan through your body, see if there's any place in your body that feels particularly tight. And if there's a particular part of your body that's feeling tight, bring your hand to it. Perhaps it's your chest. Perhaps it's your head. I'm going to start with my chest. Just noticing the tension in the chest or wherever it is that you're feeling the excess tension. Rub it. Just loosening up by rubbing it. Acknowledge that there's tension there, but there's no judgment, it's just tension. Rubbing it to loosen it up. Breathe in. And breathe out. And rubbing it again. To loosen up that tension. Breathing in. And breathing out. And this time as you exhale, allow the tension to release as you release your hand from the spot where you're rubbing. So rubbing, inhale. And exhale, just release it out in front of you. Now bring both hands, rub, Just gently rub, loosening it up. Inhale. And on the exhale, release. And inhale. And exhale, release. In front of you. Inhale. And release in front of you. And this time, inhale. Release higher, exhale. Inhale. And exhale, release up and high. And shake it out. Shake out your entire arm, shoulders. Just let it be loose. Just letting it go. And just shake out your entire body, your torso, your hips, your legs, your arms. Just shake it all out. And then just for one good measure, bring your hands back to where it was before, where your tension was, where you notice your tension. Inhale. And exhale, release. Inhale. And exhale, release. And just open your eyes if you haven't already opened them. Look around the room. Check with yourself. How are you feeling? If there's any place that feels tight, maybe it's your lower back or something, rub it. Rub your lower back. Just rub your entire body. Just feel your entire arm. And stretch out each finger. Rub your hands, inhale. And exhale, release. And do the same with the legs. Just rub your legs all the way down to your calf muscles, your toes. Do both legs. And just brush it off, brush off tension. And inhale. And exhale, release. And gather everything up. Inhale. And exhale. Circular arms. Inhale. And exhale. Allow yourself to settle down. Feel centered and balanced between both legs and your sits bones, your ischium. Feeling the length of your spine, centered, grounded, and present. Thank you for participating and to practicing some things that might help with compassion fatigue. If you have any questions, you're more than welcome to contact me. My email is at the bottom of this PowerPoint. And I hope you have a nice day and continue to practice self-compassion and tilt the scale towards compassion satisfaction. Thank you.